Hello, and welcome to the Spine Institute of Florida. In this video, we'll guide you through essential procedures, including how to prepare the room for an injection, draw the appropriate medications, and operate the C-arm effectively. First, begin by turning on the C-arm. After it is on, enter the last and first name of the patient. Next, place a bed sheet over the operating table with the white side facing up. Make sure the midline crease of the sheet aligns with the center of the table. Using 4 fingers on one hand and your thumb on the other, press down along the midline crease to create an opening for the patient's face. Now, we'll put on the lead collar with the flap facing downward. When putting on the vest, make sure to secure the Velcro straps properly on both sides. Lastly, attach your X-ray badge to the side pocket, as shown. Start by grabbing a 3 ml syringe and twisting on an 18-gauge pink needle. Pull in a bit of air first. This helps loosen the plunger so it moves more smoothly later. Next, soak a few gauze pads with isopropyl alcohol. Take out the xylocaine and marcaine vials, and clean the tops by wiping them with the alcohol-soaked gauze. Insert the 18-gauge needle into a fresh spot on the marcaine vial. Avoid areas that have already been punctured, and slowly draw up 1.5 milliliters. Once you're done, pull the needle out. Do the same with the xylocaine, wipe the top, find a clean spot, and draw up 1.5 milliliters. Just be sure not to push any of the mixture back into the vial. Once both medications are drawn, unscrew the pink 18-gauge needle and replace it with a 25-gauge blue needle. This one's better suited for injection. We will now guide the patient to the table, allowing them to sit down first. Then, assist them as they roll onto their stomach, positioning their face over the crevice. Step on the right switch to raise the bed. Use your right hand to hold the back of the C-arm and your left hand to grip the front handle. Position your right thigh behind the base of the unit, then twist to your left to guide the C-arm underneath the patient. Twist the right handle to adjust the wheel direction, allowing you to move the C-arm either toward the neck or the low back of the patient. Your target area should correspond to the region where the patient is experiencing the most pain. If the C-arm is positioned to the left of the patient, press both R buttons. When instructed, you may press the yellow button on the top of the console or the I symbol on the remote. If the spine appears too far to the right, twist the back switch upward and gently pull the machine back 1 to 3 centimeters. If the spine is too far to the left, push the machine 1 to 3 centimeters to center the image. Ideally, it should look like this. After the patient's treatment is complete, move the machine toward the patient's lower back. Twist the right handle to adjust the wheel direction. Then, use both the front and back handles to guide the machine carefully back into the corner. Step on the left switch to lower the bed. Inform the patient that they may sit up, and position yourself between them and the C-arm, as some patients may experience dizziness when rising. After the patient leaves, dispose of the bed sheet into the garbage can. Then use a disinfectant wipe to clean both the headrest and armrests of the operating table. Click on Patient Info, and then New Exam to start a new encounter. Twist the switch on the side wheel upward, then rotate the C-arm downward 90 degrees to obtain a lateral view of the patient. Then lock it by twisting the switch down. Press the up and down arrows to activate the vertical movement of the C-arm. Adjust the height as needed to obtain a lateral view of the lumbar. After capturing the image, return the C-arm to its original position.